Will chronic masturbation makes your testicles ache, from overworking? Specifically your right testicle?
Testicular aches and pains are not usually cause for alarm. However, in the case of mumps or testicular torsion, contact your healthcare provider immediately. Sudden onset of severe testicular pain is an emergency. If a young man complains of abdominal pain, the scrotum should always be carefully examined because abdominal pain often precedes testicular pain and testicular torsion. This is a twisting of the testicles that can cut off its own blood supply, causing tissue to die within hours. If tissue does die, then fertility may be affected, and the testicle may have to be removed. Common causes: injury or trauma, varicocele, dilated vein within the sac, hernia into the scrotum, epididymitis, inflammation of the ducts through which sperm leaves the testicle, testicular torsion, twisting of the cord that suspends the testicle, which cuts off the blood supply to the testicle, infection or inflammation. For sudden, severe testicular pain, see your healthcare provider immediately. Testicular torsion is an emergency, and if it is left untreated for more than a few hours, the gland may become gangrenous and have to be surgically removed. An early diagnosis and surgical treatment may prevent loss of the testis. Home care measures may reduce discomfort. Provide support to the scrotum. An athletic supporter may be helpful to relieve and prevent pain during daily activities. When in bed, it may help to place a rolled towel between the legs and under the scrotum. Possible infections include epididymitis, inflammation of the ducts through which sperm leaves the testicle. This is often caused by bacteria like chlamydia, a sexually transmitted disease. Orchitis, inflammation of one or both testicles, which may be caused by bacteria or a virus like mumps. Orchitis can occur at the same time as epididymitis or prostatitis, inflammation of the prostate gland. Fluid in the testicles often causes painless swelling, but may cause mild discomfort. There are several main types of fluid collection: varicocele, enlarged veins in the scrotum that carry blood away from the testicles. Spermatocele, fluid in the epididymis forms a cyst and often contains dead sperm cells. Call your doctor immediately or get safely to an emergency room if your pain is severe or sudden. You have had an injury or trauma to the scrotum, and you still have pain or swelling after 1 hour. Your pain is accompanied by nausea or vomiting. Also call your doctor right away if you feel a lump in the scrotum. You have a fever, your scrotum is warm or tender to the touch, or your scrotum is red. You have been in contact with someone who has the mumps. http://www.throughgreen.org/body.cfm I.D. equals 49 and action equals display and article num equals 3160. If you need anything else, please feel free to ask. If you found this helpful, don't forget to click the accept button.
Reply to Lindie's post: when giving an examination to myself, I have no pain from, meaning that, normal touching is not painful. What should I be looking for or touching for to see if everything is okay? It's not a severe pain, but it comes and goes occasionally, about 6 to 7 times an hour. A throbbing, like someone just kicked you in the groin, but just one testicle. This is an odd subject matter, but a new and scary exp. Will I have pain during ejaculation? What should I be looking for?
If there is any swelling, any bumps or lumps of any kind. If there is an infection, you wouldn't be able to tell this by a visual or by feeling yourself. If it is pain as you describe, I would make an appointment. More than likely they will do a urine test depending on the finding of that may schedule an ultrasound, but without any of those, it would be hard to diagnose in this situation. Just as would you have pain if you ejaculated. Not everyone will have the same pain for the same cause. Anything that occurs without reason, example the pain you are having, and if you know there was no actual injury, then it should be followed up with an exam. Don't feel odd about the subject. Doctors get all kinds of questions. There is no right or wrong. It is much better to be safe than sorry. But as far as your original question, unless there is major roughhousing going on during masturbation. How many times you masturbate or ejaculate will not and should not cause what you are stating you feel. I wish I could give you a direct answer. But without some follow-up tests, urine, etc., it is hard to speculate. Other than what some of the basic causes can be, which are stated in the first answer. The rest here is up to you to find out. Hopefully you have a good doctor that you trust. Even when you call to make an appointment. You don't have to tell the staff why you need to be seen, you can just say personal. They should respect that, and allow you to speak only to your doctor. Now, if for some reason you get other symptoms other than those you have listed, blood from your penis through masturbation, sperm, urine, fever, pain anywhere else, then I would go to the ER. Otherwise, do make an appointment and see your doctor, okay? Here if you need anything else.
If you have a health question and want to chat with a doctor now, visit justanswer.com/ythealth.